during one of my clinical rotations. The floor was getting a new admit. I guess she was a frequent flyer, had cursed at most of the nurses and just didn't want anything to do with them. And this hospital that I was at is like a bit understaffed. So my preceptor that day was also a new graduate herself. She had only been working for 6 months, and we had a pretty good relationship because we would sometimes learn from each other and help each other out. And I was like, should we just take her? We'll figure it out. And then, so my preceptor and I took on this patient, and I went into it knowing that this patient was going to be unhappy. So when I went into her room, I tried to be very pleasant and just introduce myself to her and ask her how her day was going and try to get her to open up. And you could tell that she was already just a little bit irritated to be there, which I understood because they said she was a frequent flyer. It seemed like she spent a lot of time in the hospital, and that is something that's very hard. She's away from her family and always getting these treatments done to her and whatnot. So I just asked her if there's anything I could do to like make today better, if she needed anything or what she wanted. And she just very bluntly said, I want to be left alone as much as possible. And I was able to cluster my care throughout the day. I only had to go into her room twice. So we had her bed alarm on and all of that, and she had all of her monitoring going. So we weren't too worried about her safety, but we were able to give all of our meds and do our assessment and any of the orders all together. And we didn't have any problems with her throughout the day. She was never upset on us or anything like that.
Okay. Yeah, we can definitely use this.
I was like wondering if that was going to be okay because she was a difficult patient, but she wasn't difficult with me.
No, that's fine. It's because the way you approached her. She would have been if you approached her like everybody else.
And
Um,
then I guess I'm supposed to add at the end what I learned from that and maybe just say that I've learned it's best to have open communication and directly ask your patients if there's any preferences they have for the day. Just like make things go smoother.
yeah. Yeah, you were the one that assessed what her concerns are and what it is that bothers her, and you were able to kind of advocate for her preferences. Because it's going to be something different with every person.
Hmm.
Someone else might be upset that you guys aren't in there more frequently, which, could have been the case with her, but you just got to know what it is that would be her preference. So, two things that I would change that people get there's, how like there's just always a new term that people are like, you can't say that now.
Yeah.
Frequent flyer is one of those terms.
Okay.
Um, so you have to say it just directly, like she had
Like
frequent
multiple
admissions
admissions.
to the unit, and they'll know what you mean. I've heard people say instead of frequent flyer, a frequent friend.
Oh, that's a good one. Because it's not like rude. That's funny.
They might be like, what did she just say? I had a frequent friend.
They might think it's sweet.
You're like, what are they teaching them in school now? And you can say you heard the nurses saying that she had been refusing care, that she had been verbally aggressive, disrespectful towards staff. I don't know if she was ever combative, but
I don't
like
think
not
she's combative. Just
redirectable.
more
Huh?
like I don't think she was physically combative, just verbally.
Verbally aggressive. Yeah.
Yeah.
And then when you said twice, like I feel like if it was a 12-hour shift and you only went in there twice, like I feel like you should at least peek on her to make sure she's
Yeah. We're
okay.
only there
What
from,
if was she only there for like 4 hours or something?
well, for my clinical, we're only there from 7 to 3.
Mm,
I think it would have been like 3 times probably if it was the whole 12-hour shift.
yeah.
I could like not use an actual number and be like, we didn't have to go in there very often, like not specifically say,
You could just say as infrequently as possible.
okay,
And then talk about how if you got any indication that she was happy about that or she appreciated that, you could add that.
okay. I don't feel I could, yeah, I don't feel like she specifically like said anything,
It's not
but she
it's
just
okay.
wasn't upset. I don't
Okay.
think she's necessarily happy in general to be there.
Mm-hmm. But she didn't refuse care, like you were able to keep her safe and yeah, okay, cool. I like this. Tell us about a time you had a difficult patient. And it's not necessarily the most difficult patient you've ever had. It's usually the story that lets you tell them the before and after and how you were able to de-escalate.
We had a patient, he came in with, and me and my nurse were assigned to help clear his wounds that he had all over his face because they had a lot of bloody discharge on there, and we just wanted to provide him a better stay at this hospital. And as we came in, the nurse beforehand told us that he was being a little bit difficult. He was agitated. So we kept that in mind. So as I entered this room, I really just start off just trying to introduce myself to the patient. I just didn't want to walk in there and make him feel scared of like, well, like who are these two people just coming in at like 6 in the morning? So I tried to introduce myself and I noticed that he was really agitated. And I was like, hey, my name's and I'm gonna be your care partner. And this is my nurse. We just want to help clean up your wounds. And he immediately said, no, like, don't. I really don't want to do this right now. And I was just trying to adapt that we have at work, which is to really just create such a warmth environment for our patient. And I asked him, is there something that we can do to help you feel better, or let's make your stay enjoyable at this time? And he really said, like, I enjoy listening to Elvis. So I asked my nurse if that was okay if we played some Elvis on the computer while we help clean his skin. And immediately, 2 minutes into the song playing, I just noticed a shift in his mood, and he was definitely more compliant. And that really allowed us to open up another boundary where he kind of trusted us more and he kind of opened up to us. And it was really nice that at the end of the day, he was more of someone that, it's easier to talk to. And yeah, like at the end of the day, like I felt like he was more of a friend to me than just a stranger like 12 hours ago.
Okay, just a couple nitpicky notes. Don't imitate his voice when you say what he says.
Oh, okay.
It was slight, but it was there. And
Yeah,
then
I noticed that and I had to stop myself for a second. Yeah, I was like, oh
it
no.
it makes the story better, but you can't do it in an interview.
Yeah, I totally get it.
I thought it'd be kind of cool if just to make them picture it more, was there a specific song that they would have heard of that he liked?
Yeah, I think it was Hellhound. Like something Hound. I had to look it up again, but I'm not really a Elvis listener, but I just remembered like something Hound, and I can't. That's the only thing I remember. But I can probably look it up tonight.
Yeah. Okay. And then I'm trying to think of something you could say at the end to bridge it forward to all the situations. Maybe you could talk about how it taught you that when you have a patient that you get in report is difficult, that you like to just ask questions about how their experience has been and get to know what's been concerning for them. And for this patient, you could tell that, and I don't know what from what specifically he said, maybe you could say you could tell that he was scared because he didn't know what to expect, that people would just come in his room early in the morning and do things without explaining them to him. And it was putting him on guard. And you were glad that he was able to open up and tell you about something that you could do to make this experience less scary for him. And it was actually enjoyable for him to give him a more positive experience in the healthcare setting and then have him actually be able to receive the care that's going to help him progress
Mhm.
instead of refuse it.
So like at the end, just like restate like what I learned from that
Yeah.
scenario. Okay.
Yeah, something that, because like, let's say there's another patient and they are upset about something like completely opposite.
Mhm.
Maybe it's that their nurses are explaining too much and it's annoying and they just want them to do it and get out. Like, who knows? Like everyone, I mean, don't say that, but everyone kind of has their own thing that is their pet peeve that their nurse might do. So
Okay,
yeah.
definitely.
Okay, so time that you had a difficult patient.
Yeah, so I remember there was a time where I arrived to my clinical rotation and I went to go meet all my patients in the morning. And I met a woman who, upon first arriving, she was very just calm and indifferent, basically. But I noticed that after the rounds, the provider had left her room and I heard yelling noise coming from her room. So I went to go check on her because I was charting nearby. And when I walked in, I immediately could tell by looking at her that she was very agitated and flustered. And she was a fall risk patient, but I saw her grab her walker and be trying to get out of bed. So I knew that this situation needed de-escalation because I could just visibly tell that she was upset and she was shouting at me to get out. So the first thing I did was I called my nurse to come help me because as a student, I was like, I'm not taking this on by myself. I needed that extra support. And then I just reintroduced myself to her to remind her who I was and approached her very like in a non-threatening, calm way and said, "Can I please sit with you? Because I just really want to understand what happened and why you're upset." And she, although was agitated at first, I think once I started to approach her with that kind of calm demeanor, that she really started to calm down. And luckily, she didn't climb out of bed. But I went and sat next to her, and my nurse joined me so that we could help resolve this together. And I asked her what had happened, and she basically said that she felt the providers were not listening to anything she was saying, and she felt ignored. And so I just sat there and listened to her and listened to everything that she was having troubles with. And I made sure to tell her that I would follow up with the provider and ask him to come back in so that we could try to correct the situation. And she was very appreciative of that and thanked me. And at the end of the situation, she remained calm and I did get the provider and he came back. But basically, what this experience taught me is that when you have a patient who's agitated and frustrated, I think it's very important to be present for them, to explain why, and to put yourself in their shoes, as well as just being very calm and non-threatening so that you can build that trust with them and get to the root of the problem. And then the last part of this for me was really actually following through with my word about getting the provider so that she felt that I was actually listening to what her needs were.
Let's word a little bit slightly differently the part where you're talking about, I think your words were, I'm not taking this on by myself. And I think
Uh-huh.
what you meant was that you know your limits of what's
Yes.
safe to take on by yourself.
Yes.
So, and I don't want them to interpret it as, no, I'm not doing that kind of thing.
Right. Yeah.
So
Yeah.
I think if we were going to word it differently, maybe we could say something like, I called for help just in case I needed more support in
Okay.
keeping patients safe,
Got it.
as she was agitated and trying to get out of bed and was a known fall risk. A phrase that might be helpful with her is, thank you for sharing this with me.
Ooh,
Yeah,
definitely.
I like your takeaway of, it went a long way. Instead of, ma'am, I need you to get back in bed, it was,
Mm-hmm.
all right if I sit down with you, and I'd love to hear about what your concerns are and
Yeah.
see if it might be something I might be able to help with. And so she was willing to sit down with you. And yeah, I feel like that was a smart way to get her to sit down.
Okay. Yeah.
Yeah, I like it.
Cool. So that does that work as like a difficult patient? Because honestly, that was like the very first story that came to my mind was like that was a difficult situation because of the agitation and the needing to de-escalate. But yeah, so do you think that was okay?
Yeah. Was
Okay.
she a two-person assist?
No, she had a walker, and that was the thing is like she could get to the bathroom with her walker, but usually there was always somebody next to her just walking with her, and
Yeah.
she was trying to get up out of bed by herself, and she was telling me she was like, "Get out, I don't want help." And I was like, "Ah." Like I recognize that that's not going to happen because she was a fall. I think she was there for a fall.
You could even
That
say
was
that.
okay.
Yeah. Was admitted with a fall from home.
Hmm.
Yeah.
Okay.
The idea that she wasn't going to let you touch her um,
Right.
right then because she was just screaming, get out of my room.
Hmm.
Which makes a little bit more sense why you feel like you needed extra support
Hmm.
in keeping her safe. I've gotten a lot of great feedback from you guys about the questions list with the 72 questions. You guys can get that for $3, by the way, with your discount code YouTube. And I wanted to build something for you where you can build out your answers on your phone that's really easily accessible. There's 33 of the most common questions that I put into a Notion template. If you don't use Notion yet, you should check it out. It's a really cool app similar to the Notes app, but it's very customizable. You can add pictures to it, you can change the colors, make it look how you want it. For each question, you get guidance on things to include, things to avoid talking about, example answers, and then there's embedded YouTube videos where you can watch other new grads give their example answers. And there's a notes section where you can type into and save your draft of your answer and start building your answers when you're waiting for the bus, or you're waiting for post conference to start, or you're in the kitchen cooking pasta and waiting for the water to boil, or just whenever something comes to you, you can just put it right in your phone in a way that's super easy to go through. You can also use the Notion app on your computer browser. You can use it on a tablet, but I wanted something for you where you can just little bit by little bit, or over the course of a night, if you have an interview tomorrow, start building out your answers in a way that's easy to break down with a lot of examples to help jog your memory for examples from your clinicals that you may have forgotten about. This is just a very streamlined way to start throwing in ideas and how to build out your answer in a way that's going to be very easily accessible on your phone.